Coming to parathormone, PTH or parathormone controls extracellular calcium and phosphate concentration. Parathormone increases reabsorption of calcium from the bones. It also helps in reabsorption of calcium from renal tubules. It also helps in absorption of calcium from GI tract. If you see the actions of the parathormone, their effect on the bones, the parathormone increases plasma calcium and decreases plasma phosphate concentration by promoting bone resorption. That is, it has an osteolytic effect. And it occurs in two phases, that is rapid phase and slow phase. In rapid phase, it is seen with few minutes of administration of parathormone. Plasma calcium is raised by increasing the permeability of the osteoclast, osteoblast, and osteocytes to calcium. And it increases calcium pump mechanism, allowing calcium ions to move from these cells to plasma. In slow phase, where it occurs in hours or days after parathormone administration, there occurs increased osteoclastic activity. Osteoclasts are large phagocytic multinucleated cells formed in the bone marrow. When osteoblasts are activated by parathormone, some osteo or proteolytic enzymes and several acids like citric acid and lactic acid are released. The enzymes digest or dissolve the organic matrix of the bone, and acid dissolves the bone salts. Eventually, the calcium ions are released into plasma. Along with calcium absorption, parathormone also increases phosphate reabsorption from the bones. The effect on the kidney. The PTH increases the reabsorption of calcium mainly from the distal tubules, collecting tubules, and to a lesser extent from the ascending loop of Henle. It decreases phosphate reabsorption. Reabsorption of magnesium and H plus ions are increased, while reabsorption of sodium, potassium ions, and amino acids are decreased. The effect of parathormone on intestine. It increases intestinal absorption of calcium and phosphates. Role of parathormone in activation of vitamin D. Vitamin D is essential for calcium absorption from intestine, but vitamin D has to be converted to 125 dihydrocholecalciferol, which is the active form. And these are some of the steps in activation. Initially, cholecalciferol, that is vitamin D3, is formed in the skin. Then cholecalciferol is converted into 25 hydroxy cholecalciferol in liver. Then 125 dihydroxycholecalciferol is formed in the kidney, and this step is under the control or supervision of parathormone. When blood calcium increases, it inhibits formation of 125 dihydroxycholecalciferol. The mechanism involved is inhibition of formation of 125 dihydroxycholecalciferol is calcium ion itself has a slight effect in preventing conversion of 25 dihydroxycholecalciferol into 125 dihydroxycholecalciferol. And increase in calcium ion concentration decreases the parathormone secretion, which in turn suppresses the conversion of 25 hydroxycholecalciferol to 125 dihydroxycholecalciferol. Actions of 125 dihydroxycholecalciferol. It promotes intestinal calcium absorption, it promotes intestinal phosphate absorption, it decreases excretion of calcium and phosphate from the kidney, and extreme quantities of vitamin D causes absorption of bone. In the absence of vitamin D, the effect of parathormone in causing bone absorption is greatly reduced. Vitamin D in smaller quantities promote bone calcification. So this is how metabolism of dehydrocholesterol occurs. It gets converted into cholecalciferol, which is inactive form of vitamin D3 under the sunlight, and this cholecalciferol it gets converted into 25 hydroxy cholecalciferol, and this this occurs in the liver, and this 25 dihydroxycholecalciferol gets converted into 125 dihydroxycholecalciferol, which is the active form of vitamin D3 in the kidney. This 125 dihydroxycholecalciferol increases the calcium absorption from the intestine and increases plasma calcium level. And this raised calcium level, by negative feedback mechanism, inhibits the formation of parathormone from the parathyroid glands. Regulation of parathyroid secretion. Calcium concentration in the blood is a main factor, and increased phosphate stimulates parathormone secretion by lowering the plasma calcium and 125 dihydroxycholecalciferol. 125 dihydroxycholecalciferol acts directly to decrease pre-pro parathormone mRNA and decreases parathormone secretion. Magnesium deficiency causes impaired PTH release along with the diminished target organ responses to